Hi everyone, my name is Emily. I'm a pharmacist here at mdcustomrx. Today we are going to be going over some different topics surrounding sexual health. Sexual health is a very important part of relationships and can affect your overall sense of well-being. As we get older and hormones fall out of optimal range, this can affect many aspects of our life, one of those being causing sexual dysfunction. I'm going to show a clip from a seminar that I did here at the pharmacy discussing sexual dysfunction. If you stick around for the end of the video, I'll do a deeper dive into a journal article that was posted by the Journal of North American Menopause Society and the effects of DHEA administered vaginally. Let's get into today's content.
So the first one is sexual dysfunction. This is kind of just like a broad term for a lot of different things. Sexual dysfunction can be defined as persistent, recurrent difficulty with sexual response, desire, orgasm, or even pain during sex. It occurs when you have a problem that prevents you from either wanting or enjoying sexual activity. Can be caused by many things such as like stress, trauma, alcohol use, even medications that you're taking, and then even relationship issues and hormone changes like with pregnancy, breastfeeding, menopause. And there's 4 different categories. And let me just say, it's normal to not be in the mood sometimes. This is only considered like a disorder unless it's only meant to be considered a disorder if it's like constant recurrent problem, happens regularly and significantly affects your sex life. So the first one is desire disorder. This is when you have like little to no interest in sexual relationships on like an ongoing basis. And then there's arousal disorder, which means like you're emotionally in the mood, but really just physically your body's not into it. And then orgasm disorder means that you're emotionally in the mood, but you have like an inability to climax, which can leave you frustrated. And then pain disorder, kind of what it sounds like, you just have pain during intercourse. And then low libido is usually caused by hormone imbalances. We see this all the time. Having low testosterone can cause low sex drive and low desire for anyone, really. So treating sexual dysfunction can be kind of tricky. First, we want to make sure that we're doing everything psychologically that we can be to be in the mood. This involves like reducing stress and anxiety and having good communication with your partner. It's also important to note that, like I said, certain medications can cause sexual dysfunction. So like there's some anxiety or depression medications, antihistamines, certain blood pressure medications even, and then many others. So if you are experiencing this, you might want to look at your medications. You can talk to your pharmacist or your provider just to see if any of those could potentially be causing or affecting your sex life. And then probably the most important treatment, like I said before, you want to test your hormones, just kind of see like where things are at. And then restore them if your levels are low. So when estrogen and testosterone are low, this can cause low desire and an inability to like get aroused. Another option would be oxytocin. This can be in the form of like a nasal spray, dissolvable tablet, or even a vaginal cream. And oxytocin is known as like the love hormone. So it's released it's like those warm, fuzzy feelings, like when you're in love, you know. It's also released during sex and can help with achieving an orgasm. And then another option would be arousal cream, which is applied directly to the clitoris. It's also known as scream cream, so you can use your imagination as to why it's called that. So this is a combination of like vasodilators that increase vaginal blood flow and increase like stimulation and response. And then, like I said, it can just increase like sensitivity. So it can be used like as needed, but sometimes when you're first starting on it, they want you to do it like once or twice a day. It can be used like a lot of different ways. And then actually a supplement that's shown to help support sexual dysfunction is fatty acids. These have like an anti-inflammatory effect and can help with heart health, which promotes healthy blood flow, which you need in order to have a sexual response. And then we also have a product called Bliss. It's a lubricant that has CBD in it. So your vagina has a lot of cannabinoid receptors in it, which I didn't even know before I started working here. And so this intimate oil can help like relax the body and mind and like stimulate pleasure and increase blood flow. And it just kind of decreases discomfort. And it also has like peppermint and black pepper in it, which can give like the heating, cooling sensation. And I actually have free sample packets as well. If you guys are interested after, I can give you some. So yeah, that's sexual dysfunction.
In today's pharmaceutical industry, there are numerous products for men, with very few options for women in regards to sexual dysfunction. Here at mdcustomrx, we're able to fill that gap for women with our compounded preparations. Of course, we do compound for men, however, we are able to offer women sexual wellness preparations that they otherwise would not have access to through traditional pharmacy. As promised, I was reviewing an article that was published about the effects of vaginal DHEA. The results are extremely promising for women that are suffering from vaginal symptoms secondary to menopause. When DHEA is applied or inserted vaginally, it's been shown to improve symptoms of vaginal pain during intercourse, skin integrity, cell thickness, and even vaginal dryness. The study showed that compared to the placebo group, women who were using vaginal DHEA had overall symptom improvement between 86 to 126%. Specifically, moderate to severe vaginal dryness that was present in 84% of women in the treatment group was resolved over the 12 weeks. Also, vaginal atrophy markers decreased by 27.7%. I hope you were able to find value in today's video. As always, if you have any questions, please feel free to comment on the video below. I do want to remind you that we offer one-on-one consultations where you can sit down with a pharmacist and we can go over any of your medications, your supplements, any questions that you have, and we can make recommendations to further optimize your health. If you're interested in that, please call us today. I hope you have a great day, and I'll see you next time.